right, so in this lecture video, I'm going to talk about cohort studies. And I'll discuss when to do them, the structure of them, and then some fundamental points about how we think about them in terms of choosing them as a study design. So when to do a cohort study? When is a cohort study a great choice? I actually really like the study design. It's probably my favorite one. But it really depends on whether or not we use it, depends on what your question is. So we go to our toolbox and we pick out the study design that is most relevant to the question that we want to ask. And you can see here that this level of evidence of cohort study is pretty high for an individual level study. It's not as high as an RCT, but it is the appropriate design when what we want to do is observe over time a group of individuals. So this is the definition of a cohort study. It's a study in which subsets of a defined population can be identified as exposed or unexposed to a factor that's hypothesized to influence the probability of a given outcome. So that's very theoretical, and I'm hoping that through a few examples, I can give you a good sense of what this looks like. But first, I want to talk about how we determine that a cohort study is a good choice. We do cohort studies when we can't ethically randomize individuals. So this may be if we're looking at something like alcohol consumption as an exposure, or cigarette smoke. If it's infeasible to randomize, such as something like genetics, we can't randomize people to their genetics. If we are inherently not able to randomize people. So a couple examples, one would be fluoridating a water supply. That's determined in the US at a municipal level. It is not randomly assigned, nor could we get the governments of different municipalities in the US to randomize people to receiving fluoride in their water versus not. Another example would be sugary beverage tax. So in the city of Seattle, we instituted a tax on sugar sweetened beverages to reduce the impact of sugar in beverages on health outcomes such as diabetes and caries. That's not something that we could actually ask other cities to randomize. We couldn't randomize cities to having a tax or not. We also do cohort studies when the state of knowledge means that we don't know what we would actually intervene on. And sometimes we do them because we can leverage existing resources to conduct them in a very cost-effective manner. And it's addressing a gap in knowledge that's the next step in terms of developing an evidence base. So what's the structure of a cohort study? Here's a graphic of a cohort study. Basically, we have some sort of study population. So in the US, we have something called the Nurses' Health Study. And in this case, nurses of a certain age are invited to be in the nurses cohort study. And the general arching purpose of this study is to look at factors that affect heart disease and chronic illnesses such as diabetes and hypertension. And so they recruited nurses, and then they collect baseline information that allows them then to categorize people as having some exposure based on diet or family history or whatever it might be. And then they follow them over time to see if they develop hypertension, diabetes, or have some sort of heart problem. So when they're recruited into the study, they don't have those conditions. Another example is the Framingham study. So we have a study in the United States that's based on a city. So individuals who lived in Framingham, Massachusetts during particular years were eligible to be part of this cohort study. These are called population cohort studies. So there's an overarching idea like heart disease or diabetes that they're interested in looking at, and they're targeting a particular population. The other option is choosing people very specifically based on a particular exposure. So this is the basis of inclusion. So an example of this might be that we want to know in a prospective manner whether or not a prenatal visit, a prenatal diagnosis of having an orofacial collapse affects children's ability to grow because they have better time to prepare for feeding their infant, for understanding the nutritional needs of their infant before their child arrives at birth. And so in this case, we would classify people. We're not going to randomize them to whether or not they get a prenatal diagnosis, right? They're just going to either have one or not. And if they have a prenatal diagnosis, we would consider them exposed. Not having a prenatal diagnosis would consider them not exposed. We would follow them over time to look at their infant's growth in the first 6 months of life. And there are different flavors of these prospective study designs, whether they're general population cohort or specific exposure. There's prospective and retrospective. So in the case of a prospective cohort study, we recruit people now. And at the time that we recruit them, they have not had the outcome that we're studying. So in the case of the nurses' health study, they have not, if we're looking at heart disease as an outcome, at the time that they join the study, they have not been diagnosed with heart disease. At the time, say for a prenatal diagnosis, they haven't given birth to their child's growth has not occurred yet. And so that's both of those are examples of prospective cohort studies. In the case of a retrospective study, both the exposure and the outcome have already occurred. So an example of this you could take the same example of a prenatal diagnosis of having a child with an orofacial cleft. And you basically get, and then the infant's growth, but all of that has occurred at the time that you start your study. So if you then go back in the charts and you identify those individuals who had a prenatal diagnosis, those who did not, and you also then abstract at the same time, before you started your study, the infant's weights at 6 months of age, that would be an example where both the exposure and the outcome of interest have occurred in a retrospective fashion. So that's a retrospective cohort study. So both the exposure and the outcome have already occurred. And there are pros and cons of doing a prospective versus a retrospective cohort. Retrospective cohorts are often much more cost effective because we don't have to recruit people, collect data from them over the time, make sure that they participate, follow up with them. We're basically taking existing data that already exists and classifying individuals as to having the exposure or not, and then following them up over time. So that's great. It makes them very cost efficient. At the same time, we may not have all the data we wanted to know about. So we're relying on data that was already collected, and maybe those data were not collected for our specific study. So that can be a disadvantage of a retrospective cohort. Whereas in a prospective cohort, you can actually design the advantage and the strength of a prospective cohort is that you can design the data that you collect specific to your primary outcome and your primary hypothesis ahead of time and collect it over time. So the other advantage of a prospective cohort is that you can look at different, you can look at multiple types of outcomes. So they're better for rare exposures as well, because you can classify people based on having an exposure or not ahead of time. And I think one of the biggest advantages of a prospective cohort is the fact that you get to tailor your data collection. A retrospective cohort has the advantage of being cost efficient, as well as you can often study people over longer periods of time. So if your outcome may not happen for several years, our funding cycles in the US are 5-year grants. And so if your outcome takes more than 5 years, it can often be challenging to study answer a particular question. And in this case, a retrospective cohort study might be a good choice. So fundamental points of a cohort study. Many of the principles of RCTs that we just talked about apply in terms of identifying the question, characterizing the study population and your sample size, your baseline assessment, the recruitment approaches and considerations, as well as the data collection. The only sort of consideration with data collection is if it's retrospective, you don't get to decide what to collect, whereas in both RCTs and prospective cohorts, you're tailoring it. So selecting your cohort, considerations are who do you want your results to apply to, and you want to make sure that's reflected in your inclusion and exclusion criteria, and in terms of characterizing who's exposed and who's not exposed. You want to make sure that they haven't had the outcome that you're studying already when you start your study. As with all studies, good measurement is really critical, both of your exposure and your outcome, but as well as other covariates. And one of the biggest differences between RCTs and cohort studies is that in cohort studies, we don't know that individuals are similar on all characteristics except the exposure. So in randomized clinical trials, because we've randomized people, we know we have we're pretty confident, and we can look at our table 1 to make sure that on other factors that matter, that the two groups are similar. But with cohort studies, we're not deciding that people are in one group or the other. And so it makes it a little more challenging and potentially problematic when we don't know whether or not other factors are similar between the two groups. We can measure it. So types of measurement, what do we measure in these studies? You can measure all sorts of things. We can use existing records, which is often the case, surgical, dental records, birth records, surveys that are tailored to the arms of the study, the aims of the study. This is most common in prospective cohort studies. And we can use validated instruments such as quality of life measures that have really good evidence that they measure what we think they're measuring. Direct measures, so phenotype, genetics, weight, dental treatment, are all other important factors that we can consider and measure. So here's the example of a cohort study that I thought I would share with you. This is also posted in Canvas and you can check it out. There's also an example of a retrospective cohort study. This is a prospective study that you may also look at and refer to for class. And that's all I have on cohort studies.